Hey everyone, it's Amy, the Skin and Lash Lady. And I'm not used to having my phone reversed. Anyway, welcome to my channel. I'm a licensed esthetician, permanent makeup artist, and lash extensionist. Today, I'm going to talk about my Derma files. So these were developed by an esthetician, and I'm gonna post a picture here. Now, this is not my client. This is the client of the woman who developed these. And you can see this is somebody who had a lot of sun damage. And by using the Derma files, she was able to improve her skin. So these, though, are only available through a licensed esthetician. And they're kind of like sandpaper. So they come fine, medium, and coarse. But through the power of Amazon and the internet, I found a company that makes one. It's called Diamond Buff, and I will link it below. And this one only comes in one grit, and it's very similar. It's kind of in between my fine and my medium on this. So today I'm going to show you how I would use this. I'm going to do it on myself. If you were a client coming to me and you had, just like this photo, sun damage. It is not meant if you have melasma, if you have active acne, or you have rosacea, because this would be a little too aggressive for that skin condition. But it is a really nice treatment to do. That particular photo of that woman, I believe she came either every week or every 10 days. So when I have a client that has a lot of freckles and the hyperpigmentation, and they don't want to do a peel from the downtime, and we still want to work on it, this is the route I go. Now, some people say, why don't you just use your microdermabrasion machine? Well, this is a little bit, I think, more aggressive, and I don't have that suction power. And that suction on the microdermabrasion machine could break capillaries. It's just not the same. And even though I have both a microdermabrasion machine and I have this, I really like my Derma files quite a lot. So let's jump right in and get working on this. So I've already cleansed my skin. I use my Glymed Glycolic wash. Any cleanser you have, just make sure your skin is all clean and dry. Now, also on a side note, I'm probably gonna be working on my chest areas. You could see I have sun damage on my chest, but I'm not gonna show it on this video. But once you see how it's done, you can also include your chest. Remember, we always start from the bottom up, from the chest up or the neck up. So now let me see if I can get a mirror positioned. I think I can see. So my skin is already cleansed. If I was working on a client, I would be gloved. My tool is dry and clean. Dry skin, we want dry skin. We're gonna start with the neck, and I'm just going always upward. I'm using some pressure, but I'm not going like this. It's up, because we don't want to abrade the skin or break the skin barrier. If you feel that it's too irritating, don't do that many passes or lighten up your pressure. So you may find at the beginning your skin feels like, what I like to say, a little spicy, a little tingly, because we are increasing circulation. We're knocking off that top layer of the skin, and it's a dry, kind of like, a dry rub on the skin. And then I usually do this. I go once one direction and then back the same direction. So I'm technically doing 2 passes. Then I move up. And this particular move on my neck also helps with, what do I talk about all the time? Lymphatic drainage. And I pull back. So make sure you have that tautness on the skin. It'd be more comfortable and better for the skin. Now I'm gonna work on my chin area here. I can either do circular motions, but I'm gonna pull down. And you have to manipulate your face a little bit. We want that stretch. And I'm going up. And as I work, I go across and back down. So I'm getting 2 passes. Okay? Now, as you could see right here, I have a little bit, or a darker spot. Any area that I have a little bit more pigmentation, I'm just gonna give a couple of extra brushes across, because I really want to lift that pigment. So pigment, every week that I do this, I'm going to be knocking off that pigment. Now, please remember, you have to wear sunblock and take all the precautions, but let's continue. So now I move over here. I'm gonna do my lip area here. The tongue underneath is great. Stretch the skin a little bit. And I go over the vermilion line as well. Sometimes I'll just go lightly like this. Especially if you wear lipstick, we can get a lot of gook in there. And I move up. And I'm just firmly holding my skin. And I go back the other way. Now I have to be careful. I'm about around the eye area. This area, the skin is delicate. We don't want to go crazy on it. So I stretch the skin. And this time, instead of flicking up because I don't want to hit into my eye, I just flick down a little bit. I'm just doing it much more, just like that, much more gentler. And then I'm going to continue up. Now I happen to have a lot of sunblock and sun damage in this area. So when I work in this area, I'm being a little bit more aggressive. It's also on the bone, so it's I can tolerate a bit more. And I was almost going to sneeze because I hit my sinus. So if you feel that you're going to sneeze, that's a normal reaction. Now my eyebrows are tattooed. I will go over them just very lightly, just to get some exfoliation. And I continue across and back over. Okay, so technically I just did that whole side of my face, 2 sweeps each, but I'm gonna work on this area of the nose here. So here, it has like a beveled edge, if you can see, which makes it really great for me to like get in the fine areas. You know, and you can manipulate and pull. Flying out my nose, it's not gonna stay that way. And now I'm gonna do the other side of my face and I'm gonna speed it up. You don't need to watch the whole thing again. So pretty much that's it. Now I could just stop right here and put on like a hydration mask, any of my serums that I want, but I like to take it one step further. A little side note, if you are on a retinol, you may want to stop a few days before you do this. The same thing if you were to come to me for this treatment or a microdermabrasion and you were on a retin-A or retinol, I would ask you to stay off of it for 48 hours before you come in for treatment. But now I want to kind of finely polish my skin. So I'm going to go get my cleanser. So I'm using the Glymed's Mega Purifying Cleanser. I washed my face originally with a Glycolic cleanser. If you have the same cleanser, you can use it the same. I've dampened my Diamond Buff and I'm gonna put my cleanser on it. So now I'm kind of like doing a softer polishing. And the same way that I just did the whole face, I'm gonna go and do it again. Now, because I have cleanser on it, I can do a little circular motion if I want. I can go up and down because it's not as aggressive because I have the cleanser to act as a little bit of a buffer. And I just keep I just keep adding more cleanser as I need to, as I work around my skin.
And usually this is only one pass and then I'm gonna wash it off. But some days I just like to get in there a little bit more. Now, if you found at the beginning that it was too rough on you, on the dry skin, then just go right to the cleansing part like this. Now, a few other things. Remember I said if you have active acne or rosacea, you really can't use this. But if you have a section, let's say that has hyperpigmentation like a forehead area, and the rest of the face has acne or rosacea, but that area you only want to work on the freckles and the hyperpigmentation, then just work on that area. Or you just want to work on your chest. You can just work on one area that's not having an active breakout or an area that doesn't have very active, get irritated a lot from rosacea. But I can already feel that my skin is very tingly, especially on my neck. And what's really important after this or anything when we do a very thorough exfoliation
is we really need to rebalance the skin, and we really need to get that hydration back in. So if you have hyaluronic acid serum, I wouldn't necessarily put on a vitamin C serum. For me, I'm gonna put on all of my Victoria DN peptides. I'm gonna put on my skin recovery mist because that's filled with sodium hyaluronate. And I'm gonna put on my moisturizer. And I'm gonna make sure, because it's daylight out, that I put on sunblock. Now, if your hand slips like mine is because I have cleanser on it, you can always take a tissue to hold the area. But this last step of going over, it's really just to like a final polish. Now I have a dry patch right here that I'm gonna focus on. And right here, let me move some of that cleanser down. I have an ingrown hair. So I have little ingrown hairs. This will help to open up the skin so they can come through. Okay, now I'm just gonna take my microfiber towel and I'm going to wash off my cleanser. I'm just gonna use a microfiber towel that I've had soaked in warm water to get everything off. Sometimes I even just leave the towel for a few minutes on my face. Like I said, my neck, the skin on the neck is a little bit more sensitive than the skin on the face. So my neck is a little, like I said, spicy. If you were using a retinol product, I would also wait and not apply it until maybe the following night. The same thing with anything that's an active or an acid. I wouldn't necessarily put them on right away. So for me right now, I am going to put on my skin recovery mist, which I already actually have mixed in this little atomizer to rehydrate my skin. I'm gonna put on all my serums, and that's it. You would do this treatment usually every week or 10 days to focus on that hyperpigmentation. And if you decide, I can't do my whole face tonight, you can just use the Derma on those areas that have the hyperpigmentation. And you really must continue with your sunblock. Even if you don't think it's a sunny day, it's really important because we're taking off that layer of skin. The skin is now much more sensitive to sunblock. Clean this. So now this has dead skin on it and a lot of stuff, and this has to be cleaned really well. So there's two ways you can clean it. Sometimes I take a toothbrush and I go in there with dish detergent and I really go and scrub the file. The other way you can do it is I rinse this off and I'll put it in, I'll soak it for a few minutes and use a Polident, one of those denture cleaning, 3-minute cleaning type of products. And then I can leave it in there and it'll get, that enzymatic will get into all the grooves and get any dead skin out. And then I will rinse them with alcohol. So my professional tools, I do that, but I also have 2 sets. So in one set had just been used. I also can send them out. My dentist will put them in her sterilizer for me. But I always scrub them. I kind of do both. I scrub it with a toothbrush. I put it in with the Polident, the denture cleaner. I rinse it out with alcohol. And then those will go into a sterilization. But for your home and you're using this on yourself, just like I said, take the toothbrush, scrub it out. If you want, put it in the Polident cleaner and don't let them air dry. We don't want them to rust, so make sure you dry them off. If you have any questions on this protocol, please let me know. Please like and comment, and don't forget to wash your face.